Inevitably, this is an area of huge patient interest. Dr. P, what are some of the treatment options available for AFib?
That's a wonderful question. It sets up kind of an overall discussion of this. When you meet with your physician, three principal types of therapy really do need to be discussed at that first office visit regarding your atrial fibrillation. And these break down to stroke prevention, rhythm control, and rate control. And let me go into them. Stroke is one of the most serious consequences of AFib. Note in the figure there's a clot in an area of the upper chamber of the left side of the heart. That can occur in patients who have AFib. In some patients, this clot can dislodge, and if it does, it goes to the brain before it goes anywhere else in the body and can wind up with a stroke, and these strokes can be devastating. There are a series of risk factors that determine who's most likely to develop a stroke. And later on, I'll discuss those with you in more detail. Rhythm control refers to whether the primary aim of treatment is to keep you in normal rhythm all the time. Ways to do this include different drugs we can talk about, as well as a procedure we use called catheter ablation.
On that note, do all patients need rhythm control?
Also a very good point, and a bit of undergoing research right now because it comes up every time you meet with a patient. Not every patient actually needs to remain in normal rhythm, and some people have such infrequent episodes, like 1 or 2 a year, that really you don't give them treatment either for rate or rhythm control. Rate control refers to the treatment that will reduce the number of impulses that go from the top of the heart to the bottom when you're in AFib. That is, the concept is to slow the bottom rate during AFib when you have an episode of AFib. In some patients, this may be the only treatment necessary to control their symptoms, and in others, it may be used in combination with drugs that are used to try and control the rhythm.
Well, certainly knowledge is power. It's important for us to know our options. And that brings us to our next topic, how to prevent stroke.